We're checking out the results today with all of them and their doctor, Boston plastic surgeon Sheldon Sevinor. Welcome back, doctor.
Thank you.
Nice to see you.
Great to see you. Thanks.
Okay, let's get going. We are going to start with 53-year-old Joanne, who was the first to go under the knife. Joanne told us she was planning on having liposuction on her abdomen, an area that had always been a problem for her no matter how much she dieted and exercised. I want to explain what you did to her, and I want to remind the audience or let them know that the video they're about to see is very graphic.
Well, I did all the operations in a hospital, which I think is the safest place for plastic surgery, actually at the Union Hospital outside of Boston in Lynn, Massachusetts. And I did Joanne's abdomen, liposuction of her abdomen, her hips, and her back. This is called large volume liposuction, and I've been doing it 24 years. And I studied it with Dr. Lewis in Paris in 1981. Little did I think in 2004 this would be the most popular operation in plastic surgery today. But it's important to realize that this is large volume. It needs to be done by a doctor experienced in a safe environment. The patient needs an extensive medical workup.
Is that fat in it?
Yes. This is 11 liters of fat that I removed.
Oh, my God.
Can't you donate that to some anorexics?
I wish I could, but I can't.
Okay, it has been 6 months since the surgery, so let's take a look at Joanne now and see what she looks like.
You have a waistline now, Joanne.
I do.
Have you been exercising?
I have. Yes, I have. Diet, exercise.
That's part of it, isn't it? That
Absolutely.
afterwards.
I told you this is not a quick fix. This is just a head start. And she's actually lost 30 pounds.
30 pounds.
And she went from 18 to size 12.
Yes,
yes.
Very good.
Well, you look very good.
I'm so excited.
Recovery okay? Not too difficult? No.
Bearable.
So the fat will not grow back in that spot again. Is that how this works?
No, but this isn't a quick fix. It doesn't allow you to eat for the rest of your life and just gain weight.
Right. Then you'll get big fat shoulders.
Exactly.
But she made a commitment to diet and exercise, which she's done.
And you look fantastic.
You look good.
You really do.
Thank you so much.
Next, we have Joanne's two daughters, Erica and Danielle, who had surgery just a few days after their mother. 30-year-old Erica told us she was going to have liposuction on her abdomen and hips, as well as a breast lift. And her 28-year-old sister Danielle was also planning on having liposuction of her abdomen and hips. And at the time, doctor, we were concerned because of their age. We thought, gee, they're awfully young to be going into these procedures.
Well, remember, there's a difference in all types of liposuction. Joanne and I did large volume major liposuction. They had moderate liposuction. They both had a predisposition to localized areas of fat of the abdomen and hips, and no matter how much they dieted and exercised, they couldn't remove it.
Really?
So all I did was help.
So show us what you did.
People don't realize what genetics plays in someone's body type. And so I did liposuction on her abdomen, you can see her abdomen there, and liposuction of her hips to give her waistline. And I also, on Erica, did a breast uplift because after having children, she had sagginess of the breast. This shows 5 liters of fat I removed. And on Danielle, she also had a predisposition to localized areas of fat in the abdomen and the hips, and I did liposuction. And for the first time, in Danielle, here's the before picture, she had no waist. And so all I did was liposuction of the abdomen and the hip area to contour her and give her a better contouring to her waist. And for the first time, she's had a waistline, and she's dropped 2 sizes and lost 10 pounds.
Well, let's see Erica and Danielle now. Come on out, ladies. You both look great. And obviously you feel great. Recovery easy for both of you?
Yeah.
Yes. It was worth it?
Oh my God, I would do it over again in a heartbeat.
It didn't hurt or anything?
No,
Really?
I mean,
Bruisey, like.
uncomfortable.
Yeah.
You know, but
But who was staying with the mom at the same time recovering, both of you? And what was that like? Because she's under recovery at the same time that you are.
my dad was home and my little sister was there, so we'd all kind of, she'd rest, I'd get up, because we had my 5-year-old, my daughter was there too.
How long after the sectioning, whatever you do, liposuctioning,
liposuction.
can you actually work out and do your thing?
She went back to work in what, 2 days?
2 days.
2 days she was back to work, and you were working out within 3 weeks, right?
Yes.
Do you recommend that people move that quickly?
It depends on the individual. Of course, Joanne was large volume major liposuction. This was not as major. And everybody has a different healing rate and a different pain tolerance.
All right. Well, it worked for you guys for sure. The next family member to go under the knife was Erica and Danielle's aunt. Rita Whelan told us that she was looking forward to having a face and a neck lift. She had already had an upper eyelid lift as well as liposuction on her lower body, so we thought Rita was a little obsessed with plastic surgery. Actually, that was the impression we had, that she's one of those people that maybe you want to say, whoa, you're still young, you don't need all of this.
Well, that deals with the psychology. Every good plastic surgeon is a great psychologist because people have to have it done for realistic expectations. Rita's gone through a lot in her life. She was a widow. She lost her husband. He had cancer. Rita looked much older than she felt. And 5 years ago, I did liposuction. She went from a size 12 to a size 6. This time I did a facelift, a neck lift, and I did liposuction of her hips. The key to a great facelift is when a person looks natural, when they don't look like someone else, but instead a better version of themselves.
When you can't tie their chin over their head.
No, and there are so many people around the country that look like they have tight cheeks,
absolutely,
but loose
because,
necks, and unrealistic.
Right.
Okay, well, let's see Rita now.
Let's
Rita,
see
come on
Rita.
out. Well, you are obviously very, very happy. You look great.
Extremely happy.
And
yes.
Can you move your face?
Oh, yeah.
Boy, that difference is dramatic.
Botox, you know.
That is a dramatic difference. And what about the recovery for you too, Rita?
It was a fabulous recovery. I have no complaints, no pain.
Really?
It was great, really. I would do it again if I had to.
Well, if you had another face.
Would you recommend, doctor, that this is enough now?
Yeah, I mean, she doesn't need anything else.
Yeah.
And she's 59. In both my Boston and Miami offices, I found that's the best time to have a facelift because it's when you show the signs of aging. And the younger you are that you have a facelift, the longer it lasts. But she's natural looking. She doesn't look pulled. She doesn't look fake. And she's, you know, she looks like herself.
But aren't some of those disaster area faces because people have too many facelifts?
Absolutely.
Okay,
There's
so,
a limit. There is a definite limit.
So you should start as late as possible, it seems to me.
No, because it lasts longer if you start younger. And why should someone wait till
But when you're
Grace
young,
is
you don't need
79?
it.
Not young, but you saw the before and after pictures. At 59, Rita had a lot of loose
So that's
skin.
what you mean by young, 59?
Exactly,
Okay.
exactly.
All right. Finally, we have the matriarch of the family, 78-year-old Grace DeMore, who went in for surgery one day after her daughter Rita. Grace had told us she was ready to have a face and a neck lift as well as a partial chemical peel.
How about breast implants? Does Grace want those?
Well, you did that story when I was on with the 80-year-old woman at Good Morning America. But Grace didn't need breast implants. Grace looked very tired for her age, but she has tremendous vitality for a 79-year-old. I did a facelift, a neck lift, and a partial chemical peel. She exemplifies in today's society what I call down aging. At 79, she can still feel young. It's like 65 is the second half of our life. Of course, I would only operate on someone at 79 that was healthy. And she had a great, this shows you how smooth the neck is. You see a lot of people in the United States with tight cheeks but loose necks, and this is the chemical peel, the best kept secret, I think, for wrinkles in the United States, because I've never repeated one in 27 years of practice.
You just pull up the neck? What did you say?
I did a full face neck lift and partial peel, chemical peel for the deep wrinkles around the mouth.
Okay, let's take a look. Come on out. Grace is going to say it was worth it too. You'd had no reservations before you went under? None.
But there are risks, doctor. A lot of people out there are saying, gee, this is a piece of cake. If I only had the cash, I'd do it. But what about some people who die on the table and it's a bad thing?
Thank God, in 27 years, I've never lost anyone. But
This is not about you, doctor.
No, I understand that. But the fact is that we think about it every day, and there are complications. And every good plastic surgeon has to go over every risk in detail and show people that there are truly risks and complications, but thank God they're very rare.
So what's next for this family, Grace, as the matriarch?
You know, the feet.
Vacation.
They're doing wonderful things with the
That's
feet,
going
I hear.
too far. That's going too far.
Well, you all look great. You did a wonderful job, doctor.
Thank you
In this
so
case,
much.
it all worked out.
They do look good.
Absolutely. Our thanks to all 5 ladies and to Dr. Sheldon Sevinor. We'll be right back.
Yes.